Hi everyone and welcome to Doc's Thoughts. So today I'm going to talk about a drug called semaglutide. It's also known as Ozempic for diabetics or Wegovy when it's used for weight loss, but the generic name is semaglutide and it's literally all the same thing no matter what you're using it for. It was originally formed as a diabetes medication, and what they found is that the diabetics who were using the medication lost significant amount of weight to the tune of 15 to 20% of their body mass, and that's a lot of weight. And as you know, it's really hard to lose weight, so when they saw something that was working so well, obviously as a company they decided to make money off of it, and they rebranded it as a weight loss drug called Wegovy. So those are the two that are available at the pharmacy, either Ozempic or Wegovy. They're both extremely expensive and you have to qualify with a qualifying condition to even potentially get it, and a lot of times it's still denied by your insurance. What you may not know is that the drug semaglutide, which is just the generic equivalent, has been being used off-label as a weight loss drug. If you look into it a little bit, you'll see articles about it. It's been in the Wall Street Journal. It's being called the bougie mom drug. People are talking about how all their friends are all of a sudden dropping all sorts of weight. So you might start to hear about it more and more because it's very, very popular. So I want to spend some time talking about it so you can make an educated decision about whether it's a good drug for you to use or not. So what is it? Semaglutide is a GLP-1 receptor agonist. I had to look at my notes to make sure I said that right. And what it does is it increases insulin secretion, so it helps your body deal with blood sugar. At higher doses, it also affects your appetite. So it gives people a reduced appetite, fewer cravings. It slows down your gastric emptying, so you feel more full all the time. And so literally, people just stop eating so much and craving so much, and then they lose the weight. It works for the majority of patients who take it. You have to actually give yourself a shot. It's a shot you give yourself once a week with an insulin needle. So a lot of people get freaked out by that, but literally, you can't even feel it. People actually give themselves a shot in the stomach, and once they do it once, it's never been a problem after that. And most people do really well with it. There's a high incidence of side effects. So since it does slow down your stomach emptying, people can feel really full. They can feel bloated. I've had patients have nausea, abdominal pain, so they can be pretty severe. But for the most part, people do really well when they take the medication. So if you're hearing about this drug and you're wondering if it's right for you, a couple things I want to share with you on this drug. So first of all, yes, most of you will lose weight if you take the drug. So obviously that's a win-win. But second of all, if you're someone who is living an unhealthy lifestyle and you use this drug to lose weight, if you go off that drug and you haven't changed your lifestyle, you will gain the weight back. So you have to make a choice to say, okay, yeah, I'm gonna just take this drug for the rest of my life because I don't wanna change my lifestyle. If you want to keep that weight off. Obviously, I don't think that that's the best choice, but that's just a reality check of what you would have to do if you want to keep the weight off. Better choice, I would say, is if you're like, I'm really not living this healthy lifestyle and it's hard and my cravings are really hard and I'm really struggling. It's a beautiful drug to kind of get you over the hump and get that weight loss to start happening, so that then you might actually have the motivation to make those healthy lifestyle changes. So that's where I've seen it work really, really well, is my patients who use the drug as like a fire under their butt or a kickstart to start losing the weight, so they feel motivated and incentivized to then make the lifestyle changes, start working out, start eating the healthier foods, so that weight stays off after they've completed the medication. So that works really well. A couple other things to think about is some people are already working out, eating really healthy, and they really have a hard time losing weight. And with those patients, I'm just really upfront with them and say, the drug might help you lose weight, but I don't know what's going to happen when you go off of it. So you might be someone who needs to kind of cycle on and off of that drug if you want to stay at your lower weight. So that's an important thing to think about. And then lastly, one of the concerning trends I'm seeing with semaglutide, and this is a very concerning trend, is that people are taking it too far. There will always be the tendency for people to take things too far and to want to be thinner and smaller. And whether you become thinner or smaller with a drug like semaglutide or by being an anorexic or bulimic is really no different. And so then it becomes a psychological issue. And so, as a patient and as a consumer, you have to be really honest with yourself and ask yourself, do I have a history of eating disorders? Am I an obsessive type person? And make sure you have a provider that's checking in on your weight and checking in on your mental well-being so that you don't take it too far, because this drug can be taken too far and we're already seeing that happen. So end of the day, semaglutide, it's a weight loss drug. It's been a game changer for so many of my patients. There are some side effects, so make sure you talk to your doctor about those and that you have a game plan for if those happen. and then make the healthy lifestyle changes while you're on the drug so that the effects of that drug will last even when you go off of it, because that should be the plan. So I hope that helps. I'd love to hear your comments about it, and I'll talk to you again soon.